We continue our discussion on the opioid crisis with a distinguished panel of experts. From Boston, Dr. Lipi Roy. She is an addiction medicine physician and clinical assistant professor at NYU, also the former chief of addiction medicine at Rikers Island. Give me your assessment of what the president said and where you think we need to focus for the future.
So I believe that the president's message is moving in the right direction. We certainly need funding, but let's be really clear. There are people right now that are struggling and dying of a disease that is preventable. It's not a mystery. We know how to treat people with opioid addiction.
The benefits of regular physical activity are well known.
There's no single treatment or intervention that can have as diverse of benefits as exercise. Particularly with the red meats, like the sausages and burgers, because remember, red meats are high in saturated fats, and the grilling process can release some of these other toxins which are less heart healthy. Of the 23 million Americans with substance use disorder, only 10% access treatment. Can you imagine if I was told that only 10% of my diabetic patients got treatment? That means the rest would be dying of heart disease, strokes, and kidney failure. And by the way, I'd probably lose my medical license. And yet for substance use disorder, the 10% that are getting treatment, we seem to be fine with that, and that's unacceptable. We need to get people the treatment that they need.
Dr. Lipi Roy practices medicine in Boston. She says hearing about exercise from a healthcare professional sends a strong message.
Studies have shown that when a healthcare professional, a doctor, a nurse practitioner, advises a patient to adopt a healthy lifestyle behavior, that patient is more likely to adopt that behavior. We need to intervene at several stages. Obviously, that late stage where people are actively overdosing and dying, so they need to get naloxone or Narcan, but we also need to be able to treat, as I said before, both with medications and counseling, but also we need to have better tools to screen and diagnose, so training doctors to make sure they recognize and do that, and then also prevention. I'd be remiss if we didn't really focus on the roots of addiction, which is really pain and suffering. For as long as human beings exist, pain and suffering will exist. And if we don't address the pain and suffering, people will continue to self-medicate. If you follow a really regular balanced diet or balanced meal plan, you don't need to then further supplement your body or your meals and your water with probiotics.
Consider all the diseases exercise can keep at bay.
High blood pressure, type 2 diabetes, obesity, stroke, depression.
And the list goes on.
It could be as simple as walking for 30 minutes 3 times a week.
The reason I come on this show and share such a personal story is perhaps it gives hope to people out there. The doctor's absolutely right. There's such a small amount of people, small percentage of people that get the help.
I really commend this gentleman and first of all, I congratulate him on his recovery, and I can't emphasize enough how storytelling, and stories of success like this gentleman and the work that he's doing at Lower East Side Service Center, we need far more organizations like this to provide care. So science and evidence-based data from people like Dr. Volkow and me, and then stories of recovery from the gentleman from Lower East Side Service Center. That's what we need.